Welcome, everyone. Thank you for joining us. My name is Drusella Stingley, and I'm a registered nurse at Robert H. Lurie Comprehensive Cancer Center at Northwestern. I'm happy to introduce Dr. Timothy Pearman, who is a clinical psychologist. He serves as the director of the supportive oncology program and is also a professor in the departments of medical social sciences and psychiatry and behavioral sciences. He'll be talking about maintaining emotional health after a gynecologic cancer diagnosis. Thank you for joining us today, Dr. Pearman.
Well, thank you so much for having me. It's good to see everybody this morning and see a few familiar faces on the call. So I'm going to see if I can share my screen. So like Drusella said, what I want to talk about a little bit today is just how to maintain emotional health after a gynecologic cancer diagnosis. I also want to note my my colleague and friend Patty Moreno, who was in medical social sciences here at Northwestern until just this year, when she got a phenomenal offer to move to the University of Miami to their Sylvester Comprehensive Cancer Center. And so she is now there, but she has been integral in developing these slides. And I know she's spoken at this meeting in the past. So first off, I just, the objective of this is really just to sort of provide a bit of a framework for understanding some of the really difficult and tricky emotions and thoughts when we're diagnosed with cancer, and to talk about some kind of practical approaches to helping to manage those. And I think, you know, to start with, it's all of these feelings that we're hit with when we're diagnosed with cancer or diagnosed with a recurrence of cancer. They can be really complicated. So, you know, it's not surprising that we feel sad and worried and scared, but you can also feel a lot of anger, guilt, uncertainty about the future, of course. And then I also want to note, you know, these feelings are also expected with all of the COVID stuff that has gone on over the past 2 years. And so when you stack one on top of the other, it really does get very complicated and can be overwhelming and difficult to know how to cope with all of these thoughts and emotions. But oftentimes we don't really talk about them much, especially with family and friends. You may feel that you don't want to burden other people, and they may feel the same way. So your family and friends may not talk much about, you know, how are you doing emotionally over time. So I think it's really important to talk about these things and just bring all this out in the open. So to start with, I want to spend a little bit of talk about attitude. So if we were in person, I would ask, who has ever heard someone say to them, you know, you got to think positive, you got to stay positive. And usually when I ask that question, just about every hand in the room goes up, because this is a message I think that people who are diagnosed with cancer get constantly. You've got to think positive, you've got to stay strong, you've got to, you know, not get depressed. But I would posit that it's not possible when you're diagnosed with a potentially life-threatening illness to think positive all the time. It's just not realistic. And so I would argue that it's really very psychologically healthy to have, again, really complicated feelings, to feel all of these things. It is definitely possible to feel happiness and gratitude, but at the same time feel stress and anxiety about your upcoming scan. And a lot of times I think people feel like you're either depressed or you're happy, you're either dreading something or you're feeling gratitude, and that's just not the case. So it's really okay to feel a range of emotions during this time. So how do we sort of typically cope? Most of us, for the most part, engage in sort of a problem-solving approach, and that really is very adaptive. So it really focuses on exactly what you would think. So figuring out the cause of a problem, and then how do we either reduce that problem or eliminate the source of that stress. And that works great in our day-to-day lives for the most part, but this strategy is most effective when the stressors are controllable. And that's one thing that I hear every day in my practice. And I'm a cancer survivor myself, so I definitely can speak to this firsthand as well. You know, many of the stressors that we're faced with when we're diagnosed with cancer are just not controllable. So you may be worried about your upcoming scans and tests and blood work, but you can't control that. And so this problem-solving approach doesn't always work. So there's a few things that I think we can do a little bit differently. And I'll talk a little bit about each one of these things: physical activity, diet, stress reduction, and our medical care. So these are the American Cancer Society guidelines on physical activity. I think they can be a little bit vague or a little bit difficult to kind of get our minds around. So what is moderate exercise? Like, what does that mean? And so I have people ask me all the time, okay, so you're telling me I should exercise. I'm willing to try it, but what kind of exercise should I do? And I will typically kind of turn that question back to the person I'm working with and say, well, have you ever had a regular exercise program? Do you have a type of exercise that you like? And if so, go back to doing that. Because if you go to the internet, if you go to PubMed, or if you Google search cancer and exercise, you will seriously find studies that have been done on every type of exercise in folks who've been diagnosed with cancer. So a lot of them are done with things that you would probably expect, like moderate intensity walking, yoga, but you will also find studies that have looked at kickboxing, Zumba classes, working out with a Wii Fit at home, doing dance classes. And pretty much to a study, all of these have been found to be beneficial. So it really doesn't matter what type of exercise you do. It's just a matter of increasing your activity. And that's really good for a variety of things. I would say, sort of, if there's any one size fits all to fix to managing stress, it's exercise, because it really works for treating not only our depression, anxiety, worries about the future. It gives us a positive distraction. It reduces the overall chance of recurrence, improves survival time in some studies. But in addition to that, it also can really help with cancer-related fatigue, which is something that greater than 90% of all cancer patients across cancer diagnoses experience at some point during their treatment. And there's really no other proven intervention for managing that fatigue other than physical activity. So I think this is just a really important thing to do for ourselves. Nutrition is another thing. And again, these are the ACS guidelines for nutrition. But again, I think they can be a little bit vague for some folks. Like, for instance, the second bullet point, limiting the amount of processed meat and red meat. My wife is a vegetarian, and every time we go to see my very Southern family, she will joke that we don't go more than one meal without having either bacon or red meat in that meal. So if you come from a family like mine, limiting the amount of processed meat and red meat might mean, okay, I'm only going to have red meat twice today instead of 3 times, instead of at every meal. And that's really not obviously the goal of this. So I think the reason I mention that is I think it's really important to make full use of the resources that you have available to you. And as most of you probably know, anyone who's treated at Northwestern, you have access to a full dietitian team that works within our supportive oncology department that can really help tailor a nutritional program guided toward your needs and whether you are looking to gain weight, lose weight, keep your same weight, or just want to eat more healthily. So definitely use the resources that are available to you wherever you're treated. Stress reduction is another thing that I think that term gets thrown around a lot. And stress reduction really differs person to person. So, I think some of these things are consistent for all of us. Engaging in activities that are enjoyable, that are meaningful, that make us laugh. That's true for everybody. But how you get to that point is really different person to person. So you may be a person that really enjoys a bunch of reading, and that's what gives you joy and creates meaning. Or you may be a person that likes to do a bunch of exercise, and that's what gives you meaning and is really fun and enjoyable for you. You might be a person that writes a lot. A lot of people find some real benefit from writing in a journal, especially as they're going through this cancer experience. Or practicing relaxation techniques, and that can mean any number of things. It can be guided meditation, It can be using visual imagery, doing deep breathing exercises. All of these things are very available, not only at Northwestern through our supportive oncology department, but most of these things, like these relaxation techniques, if you just go to Google or go to YouTube and search these things, you will find hundreds, if not thousands, of videos that will lead you through some guided meditation, some breathing exercises, even basic yoga poses. So they're easy to find, and definitely take advantage of these things, I think. The second to last little bullet on this list, I think, is really important. Asking for help when we need it. That is something that I think is incredibly difficult. It sounds really basic, it sounds really easy, but again, for a lot of us, when you're diagnosed with cancer, you already feel guilty that you're putting this burden on your family and friends. And so if you're feeling a lot of fatigue on a given day, or you're feeling nauseous, you need help getting your children to school, or you might need help picking up groceries, those kinds of things. It can be really hard to ask for that. But I will tell you, from working with both people who are diagnosed with cancer and also their family and friends, a lot of times when you ask for those things, your family and friends really consider it sort of a gift to them, because they oftentimes don't know what you need, so they'll say, let me know if you need anything, but they don't give specifics about, like, let me help you with cooking dinner for you every night this week or something like that, because they don't know what you need. So when you ask specifically for something, it really does help the people that want to help you sort of formulate how they're going to do that. So don't hesitate to ask for help with some of these daily activities when you need it. I also think attending a support group or counseling, or getting kind of one-on-one peer support, either through the Woman-to-Woman program, Immerman Angels, I think that can be really helpful as you're going through this as well. And it can give you kind of a third party outside of your family and friends, your immediate social network, to sort of talk about some of the stressors that we all experience as you're going through this. So we'll talk just for a minute about being compassionate for ourselves. Like I said, a lot of people can feel kind of guilty during this time. They can feel like they're burdening their family and friends. And I would say that, again, these difficult emotions often coexist with feelings of gratitude and joy and love, and realizing how wonderful our family and friends are, and so forth. So just give yourself a break, I would say. Let yourself feel what you're feeling, and don't feel like you have to think positive all the time. Don't get depressed. I had a mentor who's at Memorial Sloan Kettering, and her name was Jimmy Holland, and she was one of the founders of this whole field of psych oncology. And she wrote an article at one point that was called "The Tyranny of Positive Thinking." And that's always stuck with me. I love that title, because her point was, when people tell you to think positive all the time, and you get that in your head that you've got to stay positive, then when you have a down day or a down week and you feel like, I'm really depressed, I'm really scared about the future, it can really start to make us feel, again, a sense of guilt. Like, am I actually harming myself by not thinking positive all the time? Am I not coping well because I can't stay positive all the time? So again, I think it's really important to just be compassionate towards yourself. Give yourself a break. You're not expected to think positive all the time. And so also, when thinking about this, I think it's really important to sort of clarify our priorities. So obviously, when any of us are diagnosed with a life-threatening event, it makes you think, like, how do I want to spend my time? And so I think it's important to sort of ask yourself, what are my values? What's important to me? What am I like as a person? Who am I exactly? And what do we want more of in our lives or less of in our lives? Because by asking these questions, I think, I've definitely seen many people in my course of practice who have said, I wouldn't wish cancer on my worst enemy. It's been really difficult. It's a hard journey, but if I hadn't been diagnosed with cancer, I never would have thought about what my priorities were in life. And before I was diagnosed with cancer, I was spending way too much time at work. I was spending way too little time with my family. I really was just like slogging through life, and cancer really showed me that I wanted to change the equation of my life and how I spend my time. So I think it's also, again, possible to feel all the difficulties of cancer, but also really make some positive changes in our life as a result of this cancer diagnosis. And again, I think, you know, choosing some things that are meaningful to you, choosing some things that you really value, and then trying to develop some concrete goals guided by these values. So for instance, you know, I mentioned exercise and talk a lot about that. If that's a priority for you, it's really important to sort of develop some goals around that and develop goals that are meaningful. So a lot of times for folks who've been sedentary, they're not really sure how to start. Do you join a gym? Do you go walk for an hour every single day? And oftentimes we'll set some kind of unrealistic goals for ourselves. And so when I'm working with people that set that as a goal, exercise, I'll say, start small, start really small. Try to walk 10 minutes 3 times this week. That's it. Just start there. And then increase that by 20% every week after that. So the next week, you're going to walk 12 minutes 3 times a day, 3 times a week. So set these goals that are you're able to accomplish. Don't set the goal that I'm going to join a gym, I'm going to go every day for 2 hours, I'm going to, you know, because that you're likely to disappoint yourself if you don't do that. And also it's less likely that you'll actually take action if you set those broad, huge goals. So mindfulness is another phrase that I think we've all heard that has become a very popular phrase. This is John Kabat-Zinn is one of the kind of the really first proponents that mindfulness could really decrease depression, anxiety, increase our quality of life and satisfaction with life. And this is kind of his definition of mindfulness. But I actually really like this graphic to sort of describe what mindfulness is. And I think of this often when I'm walking my dog, that, you know, I will be thinking about, okay, what's the laundry list of things I have to do today? I need to, you know, work on this presentation. I need to take the car to be serviced. I need to pick up my wife from work. I need to, you know, do all these things. And I look at my dog and I realize she's just enjoying the walk, having taken in the sights, taken in the smells. And that's really what I kind of think of as mindfulness, just paying attention to the moment that you're in and the situation that you're in, and trying to enjoy that. Or I will say also, not necessarily trying to enjoy it. If you're not enjoying the moment, if you're feeling really anxious, upset, to be mindful enough to realize that situation is like when you're out at the beach, say, and you're, you know, enjoying the day. It's a beautiful sunshiny day, and then all of a sudden a huge cloud goes over the sun. It gets dark and it gets cold. Having mindfulness is the ability to say to yourself, okay, that cloud is there and it's bugging me right now, but I know that eventually the wind is going to come, it's going to blow away, the sun's going to come back. So having that ability, even in negative times, to be able to say, this will pass. This is not my forever state. That's also really important in terms of mindfulness. The other thing about mindfulness is really paying attention to your body. Because when we're stressed out, a lot of times our breathing will get very shallow, and you may not even realize that. A lot of times you may notice that you tense up. So a lot of times our shoulders will get up like this, and we may be really tense and tight in our neck. And that can cause us to have neck pain and headaches. So really important to just do a scan of your body and think about, okay, am I breathing slowly? Am I breathing deeply? Am I feeling any tension anywhere? And then really pay attention, if those things are present, to what am I thinking about? Like, what am I thinking about right now? What am I feeling? What's in the back of my mind that's causing me to have this physical reaction? So I think I've just about covered everything I wanted to, but again, just to sum up, I think it's really important to just honor these complicated feelings that we have. Give yourself a sense of compassion and allow yourself to have those feelings. And then also spend a little bit of time during this process of identifying your personal values, what you want in life, what you want more of, what you want less of, and try to create some meaning in your life. Again, mindfulness can be really important, and exercise, just any kind of exercise you want to do. The important thing is just to move more, because that will have really wide-ranging impacts on your emotional health, your physical health, and your fatigue. And don't hesitate to reach out for more help, either within your medical team or with your family and friends. I see a lot of people, honestly, that will come to me and say, you know, I've been depressed for 2 years. Well, have you told anybody? Have you seen anybody? No. And I'll say, why haven't you seen anyone or told anyone this? And the answers that I hear are variable, but the most common themes are, I don't want to be a complainer. I don't want to burden my family and friends. One thing I hear a lot is, I haven't told my doctors or nurses because I'm worried if I do, they're going to cut back my chemo dosage, or they're going to give me a break from radiation. And I do not want that. I want to be treated as aggressively as possible. I've also heard people say, you know, I haven't told my medical team this because I want them to be laser focused on curing my cancer. I can deal with the depression. I can deal with the fatigue. I can deal with the pain. I want them to just focus on curing my cancer. And so in all of those cases, I think the really important thing is, it's okay to reach out for help, and your medical team will work with you. We'll have some really good suggestions, some referrals, either within where you're treated or outside in the community. There are so many resources that are available that will actually probably enhance your treatment rather than having your treatment impacted in any kind of detrimental way. And because I knew these slides would be available to you all after this, these are some really great, I think, resources for cancer survivorship that are very user-friendly. There's some online publications and some printable publications if you want to share these with family and friends. And these come from the National Cancer Institute, the ACS, the National Comprehensive Cancer Network. So really great organizations that do a lot of patient advocacy. So definitely check these out as well. And that is all I have. I will answer any questions that anyone has. And I see one that says, Dr. Pearman, I love your common sense. Thank you, Ingrid. That means a lot to me. That really does. I really appreciate that. Well, great.
Thank you, Dr. Pearman.
I've either put you all to sleep or I've been very, yeah, I've either put you all to sleep or I've been straightforward. And again, if any questions come up after this, do not hesitate to reach out to me, to your medical team. You are all welcome to email me, call me on my direct line. I'm easy to reach. In fact, I'll put my email in the chat here in case anybody needs it. In case any questions come up after all this, don't hesitate to reach out. And thank you everyone for coming to this, and enjoy the rest of the day.